Hi, I'm Janet Weinberg. I'm the Chief Operating Officer at Gay Men's Health Crisis in New York City. And my story begins with Gay Pride March 1975. And the featured artist of that march was Anita Bryant. Most of you probably don't even remember who she is, but Anita Bryant was selected to represent orange juice from Florida and to sell hatred about homosexuals in 1975. And she did both very well. She sold orange juice well, and she sold hatred well. And it was painful to listen to her preach about how gays should basically go away, that they shouldn't exist. So at the New York Gay Pride March, there was a lot of turmoil and a lot of rise, and a lot of emotion because this woman was selling her goods. And so throughout the march, I still remember the battle cry, and it was, "Anita, you liar, we'll set your house on fire." And it was said with great fervor as people marched, thousands of people marched down the streets of New York. And those years really were, unfortunately, led by homophobia. And people were in the closet, and people were afraid to come out, and people didn't want to face the voice of those like Anita Bryant. In 1981, there was no choice, though, to step out of the closet, because the first articles about the gay cancer, the gay disease, were coming out in the newspaper. And those of us in New York all knew somebody who was either sick, dying, or afraid of becoming sick. And we stepped into a mode of, how do we care for each other? How do we get through this, and what's going on? At the time, I was becoming an occupational therapist, and one of the first ventures I had into healthcare was working in a nursing home in the Rockaways. And that nursing home had been slated to become the place for people who were dying in hospitals but taking too long and needed to get out of acute care hospitals and go to another facility, a nursing home, to die. And I remember all the preparation and all the concern and the training that we were going through. And the community was informed that this transition from hospital to nursing home was about to happen in their Rockaway community. And the community rebelled. They formed picket lines, they protested, and those patients that were slated to come there never made it. They were never allowed to enter that nursing home. The community blocked it. Again, this was all about homophobia and hatred. I also, though, remember in those days going into the hospitals, and what you saw were people that looked like they were going to the moon rather than going to see somebody who was dying. They had on caps and gowns and face masks and shoe covering and gloves, and you really almost could see no skin whatsoever. Where you'd walk into a room and there was a 30-year-old lying in their bed, looking like they were 70 or 80, ravaged by disease, and that just needed a hand to hold. And there was none. It was all cloaked in rubber or cloth. Mathilde Krim taught us a lot. Dr. Krim really was the person who I think first gave us language about how to do this. And to this day, I'm a great admirer of hers. Throughout the 80s, the homophobia beat was loud. It was quite loud. People were terrified. If you were lesbian or gay, you were associated with HIV. And if you were in the hospital and lesbian and gay as a patient, as I was in those years, it was assumed that you were there because you must have had some brush with HIV/AIDS. And that was hard. It took a lot of education to staff that no, maybe you weren't there for HIV/AIDS. And that was really the theme of the 80s. Personally, I was very fortunate. In 1991, I met the love of my life, or 1990, I'm sorry, I met the love of my life. And this December, we actually just celebrated our 20th anniversary. So it's just amidst all of this turmoil and negative emotion, love was going on. And let me tell you, it was wonderful and still is. In the 90s, mid-90s, HIV started to get better. There was the start of new medications that were saving lives, and it was no longer a death sentence, and it changed the tone, and people started to enjoy life again. And you could really feel a difference of finally an end from that daily ritual of mourning. And life starting to seep back into the lives of lesbians, gays, and eventually included in lesbian and gay was bisexual, transgender. Unfortunately for me, in 1996, I was working in the public school system and very proud to be working with youth. One of the youth that I was working with was struggling with her own sexual identity. And during that time, she accused me of sexual abuse. And of course, the school was pretty surprised. I had been there for about a decade and had a stellar reputation in the school and couldn't quite understand what was going on. And police were brought in, an investigation was done. And during the investigation, the same child accused 2 other women of sexual abuse. And it was then realized in putting the pieces together that the child clearly was struggling and had serious problems. Charges were dropped, or actually there were never charges brought on, it was just an investigation, but a terrifying investigation, and one that certainly talks to the fear of homosexuality and homophobic issues. And once the charges were dropped, of course, there was a great sense of relief from me, and this sense of, oh, thank goodness, it does get better. I ended my reign in working in schools a couple years later and decided that I really wanted to dedicate my life to the LGBT community and social justice issues, and worked at the Lesbian, Gay, Bisexual, Transgender Community Center for a number of years, and then came to Gay Men's Health Crisis. And I'm so proud of the work that GMHC does and all of the work that we continue to do around fighting issues of homophobia, and empowering people who are LGBT as part of the mission and as a way to combat HIV. And all I can say is it really does get better.